H. Hallucination. Hallucinations are usually defined in psychiatry as false perceptions, that is, perceptions which arise in the absence of an appropriate external stimulus. Huge. See American Psychiatric Association. Lacan finds such definitions inadequate since they ignore the dimension of meaning and signification. Hallucinations are a typical phenomenon of psychosis and are usually auditory, hearing voices, but may also be visual, somatic, tactile, olfactory, or gustatory. Lacan argues that psychotic hallucinations are a consequence of the operation of foreclosure. Foreclosure refers to the absence of the name of the father from the symbolic universe of the psychotic subject. A hallucination is the return of this foreclosed signifier in the dimension of the real. That which has not emerged into the light of the symbolic appears in the real. This is not to be confused with projection, which Lacan regards as a mechanism proper to neurosis rather than psychosis. In this distinction, Lacan follows Freud's analysis of Schreber's hallucinations. It was incorrect to say that the perception which suppressed internally is projected outwards. The truth is rather, as we now see, that what was abolished internally returns from without. While hallucinations are most commonly associated with psychosis, there is another sense in which they play an important part in the structure of desire in all subjects. Freud argues that the first wishing seems to have been a hallucinatory catechting of the memory of satisfaction. Helplessness, Détresse. The term helplessness, German Hilflosigkeit, has a specific meaning in Freud's work, where it denotes the state of the newborn baby who is incapable of carrying out the specific actions required to satisfy its own needs, and so is completely dependent on other people, especially the mother. The helplessness of the human baby is grounded in its prematurity of birth, a fact which was pointed out by Freud and which Lacan takes up in his early writings. Compared to other animals such as apes, the human baby is relatively unformed when it is born, especially with respect to motor coordination. This means that it is more dependent than other animals and for a longer time on its parents. Lacan follows Freud in highlighting the importance of the initial dependence of the human baby on the mother. Lacan's originality lies in the way he draws attention to the fact that this dependence is maintained by a world of language. The mother interprets the baby's cries as hunger, tiredness, loneliness, etc., and retroactively determines their meaning. See punctuation. The child's helplessness contrasts with the omnipotence of the mother, who can decide whether or not to satisfy the child's needs. The recognition of this contrast engenders a depressive effect in the child. Lacan also uses the concept of helplessness to illustrate the sense of abandonment and subjective destitution that the analysand feels at the end of analysis. At the end of a training analysis, the subject should reach and know the domain and level of the experience of absolute disarray. The end of analysis is thus not conceived of by Lacan as the realization of some blissful plenitude, but quite the contrary, as a moment when the subject comes to terms with his utter solitude. However, whereas the infant can rely on its mother's help, the analysand at the end of analysis can expect help from no one. If this seems to present a particularly ascetic view of psychoanalytic treatment, this is exactly how Lacan wishes it to be seen. Psychoanalysis is, in Lacan's words, a long subjective ascesis. Hysteria. Hysterie. The nosographical category of hysteria dates back to ancient Greek medicine, which conceived of it as a female disease caused by the womb wandering throughout the body. In Greek, hysteron means womb. The term acquired an important place in psychiatry in the 19th century, especially in the work of Jean-Martin Charcot, under whom Freud studied in 1885-1886. It was in the course of treating hysterical patients in the 1890s that Freud developed the psychoanalytical method of treatment. free association, etc., and began to form the major concepts of psychoanalytic theory. Freud's first properly psychoanalytic case history concerns the treatment of a hysterical woman known as Dora. The classic symptomatology of hysteria involves psychical symptoms such as local paralysis, pains, and anesthesias, for which no organic cause can be found and which are articulated around an imaginary anatomy which bears no relation to the real structure of the nervous system. See Lacan. However, although Lacan does discuss the symptomatology of hysteria, linking it to the imago of the fragmented body, he comes to define hysteria He comes to define hysteria not as a set of symptoms but as a structure. This means that a subject may well exhibit none of the typical bodily symptoms of hysteria and yet still be diagnosed as a hysteric by a Lacanian analyst. Like Freud, Lacan regards hysteria as one of the two main forms of neurosis, the other being obsessional neurosis. In the seminar of 1955-56, Lacan develops the idea that the structure of a neurosis is that of a question, and that what differentiates hysteria from obsessional neurosis is the nature of this question, whereas obsessional neurosis concerns the question of the subject's existence, hysteria concerns the question of the subject's sexual position. This question may be phrased, am I a man or a woman? Or more precisely, what is a woman? This is true for both male and female hysterics. Lacan thus reaffirms the ancient view that there is an intimate connection between hysteria and femininity. Indeed, most hysterics are women just as most obsessional neurotics are men. The structure of desire as desire of the big other is shown more clearly in hysteria than in any other clinical structure. The hysteric is precisely someone who appropriates another's desire by identifying with them. For example, Dora identifies with Herr K, taking as her own the desire which she perceives him to have for Frau K. However, as the case of Dora also shows, the hysteric only sustains the desire of the big other on condition that she is not the object of that desire. She cannot bear to be taken as the object of desire because that would revive the wound of privation. It is this privileged relation between the structure of desire and the structure of hysteria which explains why Lacan devotes so much attention to this clinical structure and why he develops the idea in the 1970s that it is necessary in psychoanalytic treatment to hystericize the analysand. Hysteria as a clinical structure must be distinguished from Lacan's concept of the discourse of the hysteric, which designates a particular form of social bond.